Now, I think one of the things we need to touch on as we have this conversation is that there were a couple of reasonably large studies about treatment of COPD recently, the IMPACT trial and the FULFIL trial. So I was hoping that we could walk through those, and I'm going to ask you to start with the IMPACT trial and a combination of, the patient population, the efficacy, and then more importantly, exacerbations in quality of life.
So the IMPACT trial is an interesting trial, in part because it's a very large trial. We're talking about 10,000 people, and the COPD, that's not very large in a cardiology study, but it's a very large study for a COPD. There are relatively few studies with that numbers of people. So I think that's important to start with. And what the IMPACT trial did is it looked at basically three groups. People who were on a LAMA-LABA, people who are on a LABA-ICS, and people who are on triple therapy.
Yep.
And in this trial, at least, the triple therapy was clearly better than either of the two others, both from the standpoint of exacerbations and symptoms, and there was even a suggestion of a mortality benefit. So the results were very powerful. In this particular trial, it looked like the results from LABA-ICS were a little bit better than that of a LAMA-LABA, which is different from what we've seen in other trials. When you see that difference, you need to look at who is being studied, how it's being studied, what the washout period was like beforehand. It's complicated to look at it. It doesn't necessarily mean that one study was good and one study was bad, but I think the major take-home study from the IMPACT trial is that there's certainly a subset of patients with COPD, not everybody, but a subset of patients with COPD who clearly benefit from triple therapy.
Were there any concerns about safety that were raised?
There is always the issue of pneumonias with the addition of the inhaled corticosteroid. Was not a major issue in the IMPACT study, and I think it's important to recognize that in every study where that has been shown that there's a pneumonia signal, that pneumonias don't seem to have impacted the quantity of life. They don't seem to be carrying mortality risk, but that doesn't mean they're not an issue and doesn't mean they couldn't. So as we've discussed before, every time you add a medicine or a combination of medicines, you need to view and weigh the benefits and risks of that. But there is certainly data suggesting that in a subset of this COPD population, the triple therapy is beneficial.
And they looked at both exacerbations and quality of life as well?
Yes.
Okay. And so if we could move on to the FULFIL trial?
Yeah, so the FULFIL trial is a little bit older trial, and what it did is looked at the triple therapy, a once a day, one puff a day triple therapy versus a commonly used double LABA-ICS, which happens to be, and as I think we discussed, none of us feel that ought to be a primary therapy, and in part it's influenced by these trials. But so comparing LABA-ICS twice a day to LABA-LAMA-ICS once a day. And the way this trial was designed is there were, my recalls are about 1,800 individuals randomly assigned. After measuring them on whatever their usual therapy is, so whatever they came in on, whether they were inappropriately just on short-acting, whether they were on a single anticholinergic, whether they were on a LABA-ICS, or whether they may have been on a triple, it didn't matter. They were then randomized to either the triple or the LABA-ICS twice a day. And it unequivocally showed the primary outcome in this trial, in fact, was quality of life, the St. George's Respiratory Questionnaire and FEV1, and the triple outperformed the double in all categories. And a secondary outcome measure wasn't even the primary at 6 months, was exacerbation rate, and it also showed a better reduction in exacerbation rate with the triple compared to the LABA-ICS. And so, these, I think, really, both these studies highlight that the LABA-ICS is not the appropriate therapy for patients with this disease.
Same follow-up question. Any concerns about safety raised by this trial?
So this trial, all patients were on a bronchodilator and received an inhaled corticosteroids. The only difference was one group had the LAMA. No, there was no safety issues comparing those two groups.
Okay, great, thanks.